talk to you about early detection cancer screenings, giving you some advice on how to stop cancer in its tracks. Cancer kills, as we all know. Cancer is the second leading cause of death in the United States, killing more than 500,000 people yearly. 1.4 million people are also newly diagnosed with the disease each year. So today I want to talk to you about early detection screenings that will help you stop cancer in its tracks by identifying cancer early so that it can be treated early in hopes of saving your life in the future. So after my presentation, I want you to be able to identify the screening procedures that you can take to help prevent you from dying of cancer by catching it early yourself. And I want you to take charge of your future health by seeking these early cancer screenings as recommended by the American Cancer Society. My name is Amanda Thomas, and I'm a registered nurse. And as a registered nurse, I've seen many patients who deal with the devastating effects of cancer. A lot of these patients weren't aware that the screenings were available to catch their cancer early, or many, especially males, are fearful of the screenings themselves, or embarrassed to have them done, so they refuse to have the testing, which prevents them from catching the cancer early and increases their chance of dying from the cancer. The information that I'm going to provide to you today comes from me as my professional experience as a registered nurse. I have an associate's degree in nursing with 3 years of experience, and I'm graduating with my bachelor's degree this month. Information is also going to come from the American Cancer Society, which is a professional entity that's committed to the treatment and cure of cancer, and it operates and provides information off evidence-based practice and research. So what can you do to take charge and help yourself? You can do this by seeking early detection cancer screenings, which include breast cancer screenings, prostate cancer screenings, and colorectal cancer screenings. You shouldn't fear having these screenings done. What you should fear is not catching the cancer early and letting it go undetected. It's what can kill you. First, we're going to talk about breast cancer. And this primarily affects women, although there are a few incidences of breast cancer in men. The incidence of breast cancer is the most common cause of cancer for women in the United States. 1 in 8 women will get breast cancer during their lifetime. And of those that's diagnosed with cancer, breast cancer, 1 in 35 will actually die from the disease. That's some pretty astonishing numbers if you think about it. So the types of screenings to help identify breast cancer early are self-breast exams, done by yourself, clinical breast exams done by a healthcare provider, and mammograms, which is digital radiological imaging testing that can be done. The recommendations by the American Cancer Society for these testings are the self-breast exams should start in your early 20s. Clinical breast exams should be done every 3 years for those 20 to 30, and yearly for women over the age of 40. Mammograms should also start at age 40 in women, and also if any problems occur, you identify anything in the first 2 exams, the breast exams are recommended at that time also. The next thing we'll talk about is prostate cancer. It affects men, not women. Women do not have prostate, so this is concerning men. The incidence of prostate cancer is the second most prevalent cause of cancer in men in the United States. 1 in 6 men will be diagnosed with prostate cancer during their lifetime, and 1 in 36 of those will actually die from the disease. Many that die from the disease die because they were fearful or embarrassed of having the testing and didn't catch it early. Because if caught early, this has a pretty good survival rate. The types of screenings for cancer are PSA, which is a simple blood test called prostate-specific antigen. They take your blood, detect the levels, and from there decide whether you need further treatment. And then also what men fear most is a digital rectal exam, which is done by a healthcare provider where he or she places their gloved finger inside the rectum and can actually feel to see if there's any abnormalities that require further testing. The recommendations for this are starting at age 50 for an average risk, starting at age 45 if you're at high risk, which includes African American men or men who have first-generation family members with the disease, such as brothers, fathers, grandfathers. If you have several family members that have been diagnosed with the disease, you should start your testing at age 40. Last, we'll talk about colorectal cancer, which affects both men and women. The incidence of colorectal cancer is the third most common type of cancer in men and women in the United States. 1 in 20 will develop colorectal cancer in their lifetime, with 1 in 42 that are diagnosed actually dying from the disease. Types of screenings for colorectal cancer include the flexible sigmoidoscopy, which is a flexible scope inserted into the lower third portion of your colon, viewing the colon and the rectum, and then the colonoscopy, which is placed all throughout the colon to view the inside. Recommendations for these testings are start at age 50 for both men and women, doing the flexible sigmoidoscopy every 5 years and the colonoscopy every 10 years. And then these recommendations change a little bit if you have, if you're experiencing problems with a strong family history, if there's a personal history of Crohn's disease, ulcerative colitis, or inflammatory bowel disease. So to review a little bit about what we talked about, cancer kills, but it doesn't have to kill you. You can take charge of your future by seeking these early detection screenings to identify cancer early. Women, you can do your self-breast exams, have your exams done by your doctor as recommended, and then also mammograms as recommended. Men, you can have your PSAs and your digital rectal exams done, and both men and women should follow the recommendations for colorectal cancer and have your sigmoidoscopies and colonoscopies done. So in conclusion, I want you to have the information necessary to help you reduce your risk of dying of cancer by being aware of this testing and having this testing done as recommended by the American Cancer Society. So I encourage you to follow the American Cancer Society's recommendations and have these simple screenings that just might help save your life one day.